Asthma talk number 9. Um, what to do if the patient's had an acute asthma attack and has had the correct treatment? Well, as I mentioned previously, they may have had the correct treatment and it may not have worked. If the patient is still struggling for breath or clearly in trouble after having had 10 puffs, then as we mentioned before, 999 is called. The 999 ambulance service will come around as an emergency. If calling 999, then it's important to mention to the call handler who you speak to on 999 that the patient is having an acute asthma attack and cannot breathe, meaning there is some compromise to their breathing. The ambulance service will always send out an immediate response if you mention to them that the patient cannot breathe and is unable to breathe and breathless or particularly compromised to their breathing because they're having an asthma attack. The ambulance service will come around and treat the patient, assess the patient as a priority, as an immediate. They may choose to give more of the medication that we find in the blue inhalers, but this time in the form of a nebulizer, which is a mask which the person puts on their face, and the ambulance people put the medicine through as a spray. They will very often, if not nearly always, take the patient then to hospital for them to be monitored to make sure that the asthma settles down. And if it doesn't settle down, then the patient may need hospital treatment for the asthma. We won't talk about that too much here because we're talking principally about how to recognize things in the community. If we assume, though, that the patient gives themselves 10 puffs of the blue inhaler and they're actually better, um, then that's great, and they can hold off the ambulance just for the time being. But it's very important to monitor for the next few hours because the disease process which caused the acute asthma attack may cause another asthma attack. It may still be ongoing, whether it's a cold or a viral infection or an allergic response or whatever. So the person should be kept monitored by family and friends very closely for several hours. It's important to keep the blue inhaler by them, very close to hand. And if they have a further asthma attack, then they can use the 10 puffs again with exactly the same instructions. And if those 10 puffs, as before, don't um, relieve or cure the symptoms, then 999 is called. Um, Regardless of that, if the patient gets better and doesn't need to go to hospital and doesn't need to call an ambulance, they still need to see um, a doctor within 24 hours, within 1 day. And the way to do that is to ring the GP surgery the next day and say, my daughter or my son or myself had an asthma attack yesterday. I managed to avoid going to hospital by giving myself 10 puffs at home, and could I have an emergency appointment? If the patient has had to be taken to hospital and treated in hospital and they get sent home because they're better, then they need to see their GP or the nurse at the practice who deals with asthma within 2 days of coming home. So within 1 day if the patient was able to treat themselves at home, if they were treated at hospital within 2 days. The, it's also important to note that if a patient goes to hospital, if it's bad enough for them to go to hospital, then about 15%, so about 1 in 6 people, um, unfortunately end up needing to go to hospital again within the next fortnight after having been admitted in the first place. So all the more reason to see the doctor and see the asthma nurse at the practice to make a plan about how to avoid having to go to hospital again. Asthma, as mentioned, is a long-term condition, and the aim is to stop people having acute asthma attacks and needing hospital and dying, but also to manage it in the long term so it doesn't impact on their day-to-day life, playing sport, being at home, and doing all the other things that we take for granted.